Hi, Dr. Brian Mills with PCCD in Mountain View, and I often have patients come to me with questions regarding facial pain. Often it can be tightness in the muscles here or along the edge of the jawbone. Sometimes it's radiating up into the temple area here or in the joints and around the ears. Sometimes so severe that they've actually gone to their MD because they think they have an ear infection. Mouth's a chewing system, which consists of your jaw joints, your teeth, and the muscles. And when all those components are in balance, it's very comfortable. You don't have tension in your muscles. When you bite together, the teeth fit properly and are comfortable to chew with, and you don't have pain in your jaw joints. However, when there's an imbalance in the chewing system, that's when patients can often develop facial pain. When a chewing system is in balance, if we take a look at it, when you open and close, all the teeth should touch at the same time, and the jaw joint should be in the socket when all the teeth touch. When we add the muscles and we look and they open and close and all the teeth touch in the joints and socket, the muscles are very relaxed except at the time of chewing, right when they're chewing food. Other than that, the rest of the day, the muscles are very relaxed and comfortable. And at the joint level, if we look, we see that the ball portion in the socket is centered and that the piece of cartilage is centered over the ball portion in the socket. And that the muscles that help stabilize that piece of cartilage are very relaxed, except again when you're chewing food. Some people have an imbalance in their chewing system. Either the teeth don't fit properly, so when they squeeze them together, it puts strain on the teeth and or the jaw joint and the piece of cartilage that's in the joint. And if we look at the muscles when that's occurring, they're under constant tension because they're trying to get the teeth together, but they can't properly. And so you get this tension between the muscles, the teeth, and the jaw joint. Sometimes it can be that the teeth rub so hard when they're imbalanced that it'll actually make perfectly healthy teeth sore and make it feel like you have a toothache. If we look at the jaw joint, you notice that the ball part and the socket part aren't lined up properly, and you can see that cartilage is under stress. And when it's functioning over time, sometimes you can begin to damage that cartilage where it pops and clicks, and or if it gets severe enough, you can perforate the cartilage and then end up with bone on bone. What we found is one of the most protective, least invasive types of treatment is what we call a nighttime orthotic. And what it does is it will seat the joint properly, just like an orthotic in your shoe lines up the joints in your leg. This lines up the joints properly in your jaw joint, and it covers the teeth and centers the jaw, and when you go forward, backward, side to side, it has a special protective ramp which takes the pressure off the teeth so that if you are grinding or bruxing, you do not damage the teeth. And if you'd like further information or have questions or concerns regarding either facial pain or bruxism, grinding, and what can be done for you, please go to our website at pccdsmiles.com, or you can contact us directly at the phone number below. This is Dr. Brian Mills. Take care.